You're listening to Life Unrehearsed with Matt DelVecchio and Stephanie Erickson, tackling the topics that life throws in your way. Brought to you by Severia Mobility Products, providing you better mobility for life. Call them at 1-800-931-5655.
Hello and good afternoon. It's not the best day today, a little bit of drizzle, not as great as yesterday, but here we are, happy to be talking about different issues in life. You're listening to Life Unrehearsed. I'm Stephanie Erickson, social worker and family caregiving expert. I'm here with Matt DelVecchio, certified professional consultant on aging. And again, you're listening to Life Unrehearsed, so perhaps you're caring for an aging relative, maybe you're taking care of some young kids at home, or maybe you're balancing both. Well, this is a show where we talk about all of life's challenges. How are you today, Matt?
Doing well. Yes, good weather. Yesterday sparked up the barbecue for the first time. No explosions. Everything's good.
Yeah, we had to order a new grill. Well, we've got a lot to discuss today. I'm really happy to have in studio today our guest, Susan Sofer. She's an occupational therapist. Susan, I hope we're going to talk about all sorts of driving issues today. I know you are the owner of ACT Driving. Before we get into some specifics, I just want to talk to you a bit about something that happened with me and a client today. Susan, I'm going to also ask you, make sure you pull the microphone in front of your mouth to your right.
Okay.
Don't forget the microphone. There we go. This week when I was meeting with a family, I was very happy to hear, and the daughter was happy to tell me that at some point her dad, who has dementia, was getting disoriented when he was driving. And fortunately, he decided himself that he just wanted to give up his license. Matt, you work with seniors all the time. Has this happened to you?
You know, it's funny you mentioned this, because just this week I almost had the opposite, where it was a situation where a relatively young gentleman, or late 70s, early 80s, and he's having some cognitive issues, so he's having to go through these evaluations, and it's very stressful on the family. You know, they're almost like cheering him on. They related it to going having their son try out at the hockey tryouts, trying to make the team. Well, here's a scenario with come on, Dad, you could pass it, because this, we make light of it, but it really is stressful for the family and what they're experiencing. And Susan, again, thank you for joining us. And you hear two opposites of how families could react, but I guess you get that all the time.
Well, it's interesting that you should say that, because, of course, Stephanie, when somebody makes a decision on their own that they realize the time is best now, that they're prepared to stop driving, and they'll find other ways for their transportation, it's much easier on them because they've made the decision themselves. And then the flip side is someone who their skills may not be as sharp as they need to be for driving. They're not aware of it, and the family isn't always aware of it because they're not driving with them. Because as long as their older parent is able to drive themselves, then that's great, because they're going about day to day taking care of where they want to go.
Right, they're more independent, so the family may not be noticing those little mistakes that are going on. So as an occupational therapist, and with your driving evaluations that you do all the time, I'm just curious, I'm assuming that most of your clients are older, maybe 75, 80 and up. So should we expect that as we age, we're going to lose our driving abilities? Is that normal, or is that like a misnomer that no, that doesn't happen when we age?
I just want to clarify that it's normal that as we age, our skills in general, they change, right? You don't walk as fast, you don't run as fast, you require more sleep. So things change as we get older. But similarly for driving, our skills will change, but not just because of the age. So whether you're 65, 70, or 92, it's not because of the number, it's more how are your skills. And your skills can be affected because of the medical conditions that you may have, or the medications you take to control those medical conditions.
Okay.
Yeah, you know what we're going to do right away? We're going to open it up, and we'd love to hear from you. So there's two numbers to keep in mind for call-ins. If you have something, if you've experienced this about yourselves, or if it was for mom and dad, and how you got through this process of delicate seniors and driving, please call us in at 514-790-0800, or you could text us at 514-800. Susan, one of the questions that I get, and Could you sort of bring us through the process? So we hear about evaluations, and what happens? Do you go on an actual driving test? You're back in driving school? How does it work? And I think people would want to know how that process works. What are they in for?
That's a great question, Matt, because it takes away some of the stress if people know what they're going to have to do. So usually there's 2 appointments. The first one where there's an interview to get to know them a little better, and then checking physically how they're doing in terms of their movement, their arms, their legs, turning their head so that they check their blind spots, and then doing some other testing that's looking at the specific skills when you're driving, like attention, concentration, making decisions. The second part is a road test where I do go out on the road with the driver, with a driving school instructor, and we use the instructor's car because it's equipped with a dual brake in case of emergency.
And if they pass, is it good for a year, 10 years? And how does that work in terms of a renewal?
In terms of the renewal, it'll be varied depending on what the medical conditions are. If they have a condition that could change over time, then they'll likely have to go through the process again. But whether it's in 6 months, 2 years, or 4 years, each case is looked at individually by the SAAQ.
You're listening to Life Unrehearsed. I'm Stephanie Erickson here with Matt DelVecchio, and in studio we have Susan Sofer, occupational therapist and owner of ACT Driving. We were just talking about driving evaluations. Matt, you asked a great question about how long is that renewal good for. I was hearing something about once you're at a particular age, it's automatic that you have to be tested. Is that true?
When your driver's license comes up for renewal at the age of 75, if the licensing bureau didn't know anything about you before from a medical point of view, they will send you 2 forms. One that has to be filled out by your family physician, and the other to be filled out by an ophthalmologist or optometrist.
When you say you were not previously known for medical conditions, so are you implying that physicians or a professional has to notify based on a certain, range of conditions?
That's correct. Stephanie, sometimes once you've had a stroke and maybe everything went well and you went back to work, really, if you've had a stroke, you should be letting the licensing bureau know. Sometimes people have been involved in an accident and they've asked for a handicap parking sticker. When that happens, if you're a driver, the licensing bureau knows about it. They'll send you a medical form and want to know what's happened. Why does our driver need a handicap parking sticker? Doesn't mean that they can't continue to drive, but at that point you become known to the system on the medical side.
Okay.
We have a caller in, and it's Ron that would like to ask you a question.
Sure.
Hi, how are you?
I'm good. What's your question, Ron?
My question is, I received a letter 2 days ago that they're going to revoke my license July 21st, 2017 because of my conditions.
Okay.
But you just basically answered my question with the other lady because I have a handicap sticker.
Right.
So now I received this form for the first time since I didn't know they knew I was sick. I knew they knew I had a bad leg.
Okay.
But
So your question to Susan then is maybe, do you have any recourse? You've been given this.
Yes.
Okay.
Yes.
So Susan, once you get a letter, can Ron, does he have a way to plea his case and try and keep his license, or what happens?
I would read your letter very carefully and see what the procedure says, whether it says that your license will be suspended as of a certain date, or if they've asked you to go possibly to do a road test at the licensing bureau is a common action that the licensing bureau asks. And then, of course, you can always give me a call and we can go through it on an individual basis to see your situation, what's happened until this point, and what the best course of action would be.
Okay, that would be great.
And we'll be giving contact information at the end of this broadcast, and you could always refer to the Life Unrehearsed Facebook page as well. One of the questions that we often get, Susan, is about how do we start the conversation with a parent? You might have experienced something, you were driving with them, and you noticed that, that wasn't right, and there might be a couple of other incidents. So we'd like to know more about that, but what we're going to do first is we're going to get a quick traffic update, and we're going to send you off to the CJAD Traffic Center.
This is Life Unrehearsed with Matt DelVecchio and Stephanie Erickson. Brought to you by Severia Mobility Products, providing you better mobility for life. Call them at 1-800-931-5655.
On the road again. Just can't wait to get on the road again. The life I love is making music with my friends. And I can't wait to get on the road again. On the road again.
There's a little Willie Nelson for us. You're listening to Life Unrehearsed on CJAD 800. I'm Matt DelVecchio here with Stephanie Erickson, and we have Susan Sofer here from ACT Driving, responding to questions we have about seniors and driving. Susan, thanks for being here.
Pleasure.
Just before traffic, we talked about how do we have that conversation with parents. You might have seen or experienced being in the car that, ooh, that was a little risky, and how do we go about having that conversation?
Excellent question. Not always easy to answer.
And there's a simple answer, and you're going to give it to us exactly what works.
in 1 minute or less. Ideally, what you want to do is choose who's the best person within the family to broach the subject.
Not me.
With the parent. Whoever they have the best relationship with, whoever they take information and advice from the best. Always choosing the most opportune time, being calm, not being rushed. Tone of voice is extremely important. After that, I'd say trying to sort of strike while the iron is hot. If there's been an incident, if you happen to have been with them when there was a close call, then you can use that and say, you know, I was really concerned, Mom, when this happened. And I wonder if you could tell me, do you know or are you aware, has this happened before? In terms of, you know, somebody honking, close calls, going to make a lane change, not realizing somebody was there. And sometimes you'll get an interesting response where they will say, yeah, I was a little nervous. I'm not sure why this happened to me because it's never happened before. And that's when you can broach the subject and say, you know, maybe we should look into it. And it's always the same way you would go to the doctor if you weren't feeling well, and they do a test and they may send you for some tests or x-rays and then decide what the treatment would be. It's the same thing for driving. That if something has changed, if you've been more at risk in terms of an accident, let's find out why and see what we can do to make sure you're safe.
Okay, so you're saying that so nicely, Susan. So if I'm in the situation, I'm calling you, and now I've chosen you. You're the best person, maybe someone not in the family. We're getting some texts and calls coming in, which is great, because obviously this is a hot topic. Lots of people have questions for you, Susan. And if you have a question, or perhaps what I'd like to hear is how your parent reacted when you asked them to stop driving or brought up the conversation, make sure to give us a call here at the CJAD station. Matt, I don't have the number in front of me.
514-790-0800 to call in. And text us at 514-800.
Thank you. Let's go to Donald. Donald, you're on the line here, and it says that you have a medical driving test question. Welcome, Donald.
Good afternoon.
What's your question for us, or for Susan, actually?
Okay, I just turned 75, and I had those forms filled out by a doctor and an optometrist, and I've been approved to continue driving.
Excellent.
Great.
At what point will I expect to have to do that again?
Oh, good question.
If everything was fine on the form, depending on what your medical history looks like, they may not contact you for another 5 years.
Okay, that's great. Thank you very much.
Drive safe. Hands-free.
Will do.
Yeah, he is hands-free. I can tell that he's hands-free. That's good.
Thanks, Donald. You're listening to Life Unrehearsed. I'm Matt DelVecchio with Stephanie Erickson, and we're here with Susan Sofer from ACT Driving. One of the questions that we get often is, okay, let's do a worst-case scenario, and the driver's license has been revoked. And at the beginning, obviously, very traumatic, stressful, when in fact it may not be the end of the world. And how are families, from what you've seen, adapting to, okay, no more license? What do they do to try to adapt as a family and as the individual?
As a family, I find that people are supportive, helping to make a schedule, letting their loved one know that they're there for them, be it their children, the grandchildren, and so they're there to help out. Also to look at if the person physically is able to walk around, has good stamina, helping them to learn the public transit system if possible. Also in terms of taking taxis, showing them where they can call, having the taxi tickets so they don't have to worry about having the cash or using a credit card if they're not comfortable, because you can have an account with the taxi companies. So it's helping the driver who has to stop driving to know what their options are.
And it's also helping the family, because it's still giving the driver some independence and autonomy. And so maybe the family doesn't have to do as much if they're like setting up these systems, putting the systems in place.
Exactly. Trying to give them as much autonomy to continue on their own as possible.
We have a text coming in. I'm going to get right to it. Susan, this is an interesting situation. The person writes, that she or he is going through the situation with his or her father, who's 70, physically able to drive, but diagnosed with dementia. This person wants to get the CLSC or a doctor to sign the SAAQ forms, but because his decision-making abilities have been impaired, and it's very frustrating because even when you explain it to the physician or to the person, they don't believe that they're impaired. So this is probably pretty usual.
Yes, that's common. It's obviously the easiest pathway is when you can get your physician on board to fill out the medical form. If the physician does not want to, what I would suggest is trying to talk to your loved one to explain that, I worry for your safety. And what I'd like to know is nothing more I'd like is for you to continue driving and carry on as usual, but I'd feel more comfortable knowing that you're safe. I don't want to be home worried. I haven't heard from Dad yet. I hope everything's okay. He didn't run into any trouble.
Yeah.
You're listening to Life Unrehearsed. That was Susan Sofer. I'm here with Stephanie Erickson, and I'm Matt DelVecchio. I guess that's a common question, and going back to the original story that I had gave, where there's this almost refusal, just like you were talking about, and they're almost just keeping it quiet, right? They don't want to say anything. And can doctors intervene and simply say, no, your license is suspended immediately, and what happens in those cases?
Yeah.
It's a good question. A doctor could say that, and if a doctor says that, it must be pretty obvious that that person should no longer be driving. Often what I recommend is that the physicians talk with the patient to tell them that, I have a responsibility to inform the licensing bureau if somebody is no longer safe to drive. But I'm not the best person to determine if you're safe on the road. I know about your medical conditions and if they could affect your driving, but you should have a more formal assessment for us to know, have your medical conditions affected your ability to drive or not?
So now you're talking about the doctor and the doctor intervening and saying something to his or her patient. But I'm curious because families sometimes tell me that they're telling the doctor and the doctor's either not listening, or even worse, they're trying to get a hold of the doctor. They can't, or the doctor says, you're not my patient, your dad is, I can't talk to you. What can families do in that situation when they have seen things and they are concerned not only for their parent or another aging relative, but other people in the public or in the community? What can families do in terms of getting in touch with the doctor and explaining their concerns?
I think you can certainly call the doctor. The doctor can listen to you, but he might not discuss or tell you what he's going to do. And the other is, if you cannot get the cooperation of the physician for one reason or another, you can call the licensing bureau to say that you are concerned, you don't have any medical forms, but let them know of your concern. And they could send the medical form out to the client, and then the doctor won't have a choice but to complete it.
We have a great text, and I think a lot of people may want to be in this position. Hi, I have a family member who is 95 years old. He's in great shape and still driving, which I find amazing.
I do too.
Is there a cutoff date by age, or you just keep going until you go?
You keep going until you go. There is no cutoff date, and as I said, age alone is not a reason to stop driving. It's a matter of how well is a person aging.
Okay, and what if they're young? My husband's going to kill me. But he becomes completely different when he's on the road. He has all his skills. He has all of his cognitive functioning. But even my children will back me up here. He gets on the road and he becomes a different man. What do we do then?
Well, if it's...
Is that marriage counseling?
Hopefully somebody such as your husband who has all his faculties, he may be angry, but does he create a danger to himself and others? If somebody's behavior is impacting their style of driving or typical style of driving, then it is a reason for concern, because certainly behavior and mood can affect driving.
Okay, that was tongue-in-cheek. Do not get mad at me, Philippe, when I get home.
We'll be having an anger management show coming up on Life Unrehearsed.
Exactly. This is great, Susan. Do you have any last questions, Matt, that you want to ask?
A quick one, because there seems to be, from an adult children's perspective, they feel a lot of the burden and the stress. And whether it's by choice or by volunteer. But do you see that a lot in your world, where you're talking as much to the adult children as you are actually to the seniors?
Absolutely, because it's emotionally, it's very hard on the child, the adult child, to watch their parent go through this and know how devastating it might be for them, and the lifestyle changes. And as well, as you said in your example, the adult children don't always see the difficulties that the driver is having. So often it's explaining to them what the problem is and what we could do about it, or why it's a danger and why it's important that the person stop driving.
Yeah, and one of the things that we didn't get into a lot, Susan, we'll have to save that for another show, is what it means for a person in terms of their lifestyle. You kind of touched on that, the loss of autonomy, independence for a lot of people.
Dignity.
It's who they are, dignity, all of those kinds of things. I'm sorry that we ran out of time and didn't get into that. We'll have to have you back on. Thank you so much. Susan, you were mentioned to somebody that he could call you. What's the phone number to reach you?
514-733-1414.
Perfect. And also we have, you can reach Susan Sofer, occupational therapist, actdriving.com. Is that right?
That's correct.
Okay, great. And that link will also be on the Life Unrehearsed Facebook page, so feel free to visit there. Thank you so much, Susan, for all of your advice and conseil, and I'll talk to my husband, and I'll probably call you later for some help on that end. I can't wait. After the break, we're going to be talking about music therapy, but right now we're going to go head over to the traffic center.
This is Life Unrehearsed with Matt DelVecchio and Stephanie Erickson. Brought to you by Severia Mobility Products, providing you better mobility for life. Call them at 1-800-931-5655.
Oh, someday, girl, I don't know when we're gonna get to that place where we really wanna go and we'll walk in the sun. But till then, chance like us, baby, we were born to run. Honey, chance like us, baby, we were born to run.
Hey, how about a little Bruce Springsteen to start us off on the second half of the show? You're listening to Life Unrehearsed on CJAD 800, where we talk about the ins and outs of family life. You can check us out on our Life Unrehearsed Facebook page. I'm Matt DelVecchio, certified professional consultant on aging, here with Stephanie Erickson, social worker and family caregiving expert. Hello, Stephanie.
Hello, Matt.
Well, I think most of us have these go-to songs, if you will.
Yeah.
And they could be for various reasons. It could be for motivation and getting you pumped up, or it could be for through getting you through some tough times. And I picked that particular song, The Boss and Born to Run. One, I love the tune. I find it very inspirational. And also, songs usually bring you some memories. And in my case, I was very fortunate to see The Boss twice in concert.
So lucky.
Once was actually on the Shome bus back in the 80s with the boys, and we went down.
You're dating yourself.
Yes, went down the 401 and saw him at the CNE exhibition stadium outdoors.
God.
And then more recently, I saw him with my wife at the Bell Center. And so they bring back really good memories. So that would be what I would consider certainly one of my go-to songs, if not the go-to song. And I know music means a lot to you, Stephanie.
It does, and one of the things is memories. It's true. When you get to the 90s playlists, all the club days come back in my head. I mean, you're talking about that song being more motivational and inspirational for you. We're going to listen to my song later in the show, and mine was really more about healing. That I used that song, I used it and continue to use it when I'm in a difficult time emotionally. And that's kind of what music is for people. It can do all sorts of things. But there's also formalized music therapy, which it can actually be used to help people. And super excited to have on the show today Dr. Laurel Young. She's the Associate Professor of Music Therapy at Concordia University, and she's going to tell us a bit about how music can actually heal people and be used in a formal way. Welcome to the show, Laurel.
Thanks for having me, Stephanie.
It's great to have you here. So before we dive into some specific questions, can you just kind of explain to us what music therapy actually is?
Well, that's the question we always get asked, and it's kind of our cocktail party question as music therapists. And because it is a whole profession, it's hard to define succinctly, but I'll do the best I can. Like I said, it is, and as you pointed out, many people find music to be therapeutic and healing in their lives, but music therapy actually is a formalized clinical profession. And we use music experiences or music interventions and the relationships that develop through those experiences or interventions to address identified areas of need. So those areas of need may be in the cognitive domain, communication domain, emotional, musical, physical, social, and or spiritual. And I would say that music therapists also serve as professional consultants to help others implement what we would call best music practices into their everyday lives in order to promote health and well-being. So it's not just about treating problems and issues, it's also about health promotion.
Laurel, welcome. It's Matt here.
Hi, Matt.
We had a great conversation last week and just prepping for the show, and I was fascinated about what you were talking about in music therapy. I really had no idea how involved it is, and it could be applied from seniors all the way down to kids. And I know you had a great presentation at the Alzheimer's group this week focusing in on music helping patients with dementia. Can you elaborate a little bit more on that?
Well, yes, and as you said, we really do, as music therapists, work with people of all ages and abilities across the spectrum, the life spectrum. But in terms of one of my areas of expertise, it really is working with people who have dementia. And part of the reason, can you hear me? I feel like I'm breaking up a little bit.
Yeah, you kind of are breaking up a bit.
Okay, hang on, let me just...
So what we're going to talk about music therapy and dementia.
Is that better?
Yeah, that's much better.
Okay, we'll try that then.
Oh, yeah, that's much better, Laurel. So keep going.
Part of the reason that music works really well for persons who are living with dementia is that the areas of the brain that are related to musical functioning are often fully or partially preserved in persons with dementia. So as other functions such as language and orientation deteriorate, the music functions actually often remain intact. And in fact, music perception, sensibility, emotion, and memory may even be heightened as dementia progresses. So I kind of think of that like if you were imagine yourself in a place where you didn't really understand your surroundings, you really didn't have a good sense of what was going on, and people are trying to communicate with you, but you really don't understand. And then you hear music, and it's something that you understand. And that is regardless of whether you have had any musical training or significant background in music. It's just that those functions of the brain are working.
Yeah, and it really
creates
does
a pathway where we can engage with these individuals, help them to remain in constructive relationships with others, remain engaged in their environment, and even remain connected to themselves.
Yeah, you're making a good point, too, about how whether you're a professional or not, music touches people. I have a question for that. Just want to remind everyone you're listening to Life Unrehearsed. I'm Stephanie Erickson here with Matt DelVecchio, and on the phone we have Dr. Laurel Young. She's an associate professor of music therapy at Concordia University. I guess that's why, like what you were saying and what Matt and I were referencing is that you hear a song and it kind of just connects with you on a deep level. And I know you're talking about people with dementia, but there can really be a shift in your experience regardless, because I certainly know that for myself with music, I could be in a particular mood and hear a song, and all of a sudden things just change, even if there's no memory associated. But it does. It really connects with us on a very deep level.
It connects with us on a deep level, and there is that familiarity and that predictability and the memories and feelings and things that we have associated with it. I would also say that music therapists use a lot of live music in their work, and so what we're doing, too, is we're being in the moment with that individual. With the music. So in addition to building upon exactly what you're talking about, we're also working with them in the here and now and adapting and adjusting the music as they respond to meet their needs as they emerge in the present.
And Laurel, it's such a broad therapeutic measure in the sense that when we were talking, you talked about autism and even kids. It's not just for adult children or seniors. And could you elaborate a little bit more on some of your experiences when in a child environment?
Well, when working with children with autism, again, although the issues are different, the function in many ways is still the same. So it really depends on the context within which you're working with a child with autism, how you might use the music. So there are some programs where they would use an ABA model, and they're using the music very much in that kind of a model
What's
as a
ABA?
reward.
Can you just Laurel, clarify what you meant, ABA, because you threw
applied behavioral analysis.
Okay, thanks.
So you're using in that situation the music really as a reward or as a way to motivate the kinds of behaviors that you would like the child to do. But you can take that from the flip side. I worked with a young boy with autism, and he had that kind of approach at school. But what his parents really wanted from music therapy for him was to actually to be able to engage in experiences with him that were enjoyable and that they could do together as a family. So instead of always sort of putting expectations on him about what he should do or what they wanted him to do, we actually used the music to create a bridge to connect with him so that they could have shared music experiences together that really evolved from his ability to engage in the music.
You're making such a great point, Laurel, about how music can connect us with other people. And I think for caregivers or anyone, whether it's a senior, a child, mental health, whatever it might be, sometimes we feel like we're ineffective and we're looking to kind of do something to create some kind of a connection. And music is a great way to do that. I definitely want to hear from you about how music has been healing from you personally, and I'm looking forward to sharing with you actually the song that I was mentioning earlier. Well,
I'm looking
you'll hear it in just
too.
a second about how I've used that to actually heal myself in a bit. But first, we're going to head over to the CJAD Traffic Center.
This is Life Unrehearsed with Matt DelVecchio and Stephanie Erickson. Brought to you by Severia Mobility Products, providing you better mobility for life. Call them at 1-800-931-5655.
Whatever tomorrow brings, I'll be there with open arms and open eyes, yeah. Whatever tomorrow brings, I'll be there. I'll be there.
Well, you're listening to Life Unrehearsed on CJD 800. I'm Matt DelVecchio with Stephanie Erickson, and we're very pleased to have Dr. Laurel Young talking to us about music therapy. We want to encourage some call-in if we can in the last few minutes. So just a reminder, if you have any questions about how music has been healing for you, we'd love to hear from you either by phone or by text. So please call us at 514-790-0800 or text us at 514-800. Stephanie, that was a great song, and that's one of your go-to songs.
It is, and I know that you said earlier you weren't even that familiar with that song. That song, it means so much to me. It came to me, I've always had anxiety, which I think we're going to talk about in a few weeks. We're going to do a show actually on my anxiety. I'll open up about it. But it came to me, that song, in a very particularly difficult time. And the whole song is about, no matter what happens, I'm ready for it. Open arms. I'm in the driver's seat. The song is called Drive, right? So I'm in the driver's seat. I can take control. Life doesn't have to happen to me. I can do something with it. And for someone who has anxiety, it's quite empowering for me. And whenever I'm feeling a little bit out of control, like I don't know what's happening, I listen to that song, and it really turns not only my mood, but it actually empowers me to know that I don't have to be fearful about stuff. I can actually take control.
Yeah, I think the control is part of it, and the fear of not having control. So I could see where you're coming from. Laurel, one of the questions that we had for you when we were talking prior, you had mentioned we've talked to music, but I think you're doing some research about the benefits of singing. And no, you're not going to get us to sing on the air here.
Oh, darn, I was hoping to get you to sing.
Oh, no.
So, from what I understand, you're seeing more and more of that as being therapeutic.
Oh, absolutely. And then there's the obvious, physical benefits that one can imagine when one does sing. But I think, what I've heard time and again from people who have attended some of my singing and health groups, that I've facilitated in various contexts is that they have been told not to sing, or they've been told that that they don't have a pleasing voice, and so they haven't sung for a number of years. And really, honestly and truly, everybody can sing. Everybody does have that capacity. It's really an innate human quality. All normally developing children do sing, and it is not until we tell them to be quiet that they stop. So maybe not everybody should be singing in Carnegie Hall, but everybody really should sing. It's a wonderful way to connect with yourself, to connect with how you're feeling. It really creates an awareness. And it's such a wonderful outlet for people to express themselves.
It's true, and I do a lot of singing, but it's in my car, thankfully, and usually I'm alone, which everyone should be thanking me for right now. You're listening to Life Unrehearsed on CJAD 800. I'm Stephanie Erickson here with Matt DelVecchio. We're talking with Dr. Laurel Young, Associate Professor of Music Therapy at Concordia University. Laurel, I'm just curious, for the average person out there who maybe doesn't have access to, formalized music therapy courses, or, someone of your talent or skills, how can we integrate music in a therapeutic way, like a formalized way, that if with someone that with whom we're caring for? For example, I'm caring for let's say my son who has autism, or an aging parent, or whatever it might be. How do we do that?
Well, I mean, that's a huge question, and there is a lot more. I do understand what you're saying about not necessarily having a music therapist do that, but music therapists are working more and more as consultants for people to help get them started with this sort of thing. I would say one very important thing is to really take your cues from the individual person. I think one of the mistakes that or assumptions perhaps that people have about music is that it's always going to be helpful and it's always going to cheer people up. And just like you were saying, when you are feeling anxious or down, you have a go-to song that you go to, but you're choosing that and you're controlling that, and that's key. Because you can't impose something upon an individual that you think is going to be helpful because it's helpful for you. So a cautionary or a bit of advice that I would give is to really try things with your individual family member to see what's going to work best for them and to see the context within which it works best, and to recognize that sometimes no music is the best choice. It really needs to be used with a lot of thoughtfulness and care.
You're listening to Life Unrehearsed, and that's Dr. Laurel Young, Associate Professor of Music Therapy at Concordia University. I'm Matt DelVecchio with Stephanie Erickson. Now, the first thing that caught my eye was Associate Professor of Music Therapy. Didn't even know music therapy in university level existed. And from what I understand, you're actually teaching students to become music therapists.
We are teaching students. We have 2 music therapy programs in the Creative Arts Therapies Department at Concordia, and we are teaching students in our graduate diploma music therapy program how to become music therapists, which involves a 1,200-hour internship in addition to coursework. And we also have a master's program for persons who want advanced training in music therapy, and we actually also have PhD students now.
Amazing. Wow. And real quick, how do we find a music therapist?
There are a couple of ways. In Quebec, there is the Association Québécoise de Musicothérapie, and that is at musicotherapyaqm.org.
Great.
Or you could also contact the Canadian Association for Music Therapy, which is at musictherapy.ca. Or you can also email me. I'd be happy to answer anybody's questions about music therapy.
That's great. So I know, Laurel, that we posted a link to how to get in touch with you on our Life Unrehearsed Facebook page. Since you're opening it up for people to email directly, can you just quickly give us your email address?
Yeah, it's laurel.young, so laurel.young at concordia.ca.
That's great. Thank you so much, Laurel, for being on the show today. We really appreciate it. I'm happy to learn more about the formalized profession of music therapy. Certainly, Matt, you and I both agreed music has been very helpful for us in our lives. And thank you again, Laurel, for joining us. You can learn more about us on our Life Unrehearsed Facebook page, and you can catch us every Sunday from 4 to 5. Next week, we're going to be talking about bullying at school, and we'll also be talking about posture and balance for seniors. First, we'll send it off over to the CJAD 800 newsroom.